Okay, welcome. Let us see the course content of application of GIS and remote sensing in public health for health professionals. This course is being supported by Spatial Engineering Online Homeschool, Frontex Service Africa, and the Africa Environmental Watchbird Association. At the end of the course, you are going to have, or at the end of the program, you're going to have a certificate issued by Africa Environmental Watchbird Association. And from Module 1, we are going to start with Introduction to GIS Remote Sensing in Public Health. Module 2, we are going to see the fundamentals of GIS and remote sensing. Module 3, we are going to see data source and management, where we can acquire data. Module 4, we are going to see GIS remote sensing mapping techniques. We are going to see the different spatial technique as far as public health is concerned. Module 5, we are going to see disease surveillance and outbreak investigation. Number 6, we are going to see health resources allocation and planning. Number 7, we are going to see environmental health and GIS. Environmental health and GIS/remote sensing. The instructor for this course is Mr. May Armstrong. I'm the one, the specialist in GIS remote sensing from the Africa Environmental Institute of Space Science and Technology, affiliated to the United Nations in Nigeria. Okay, for the module, okay, let's go now to the other modules. For module 8, we are going to see epidemiological application of GIS and remote sensing. Module 9, we are going to see emergency preparedness and response. Module 10, we are going to see ethical consideration and challenges. Module 11, we are going to see hand-on GIS remote sensing training. There we are going to see work a lot on practical application here. Module 12, we are going to see future direction and innovative. Let's get back to the module 12. Okay, so we are going to module 1. Under module 1, we are going to see the details of the course content on module 1. Let's say module 1, we have introduction to GIS and remote sensing in public health. Now, under module 1, we are going to look at the overview of GIS and GIS remote sensing technology. Then we are going to see the importance of GIS in public health. Then we are going to get into the historical context, how GIS have been the evolution of GIS as far as public health is concerned. We are going to get into the historical context. Then we are going now to move to module 2. On module 2, which was fundamentals of GIS and remote sensing, we are going to see basic GIS concept and terminology used in the field of GIS as far as public health is concerned. We are going to see the component of GIS, hardware, software, data, people. But here we are going to talk about software, the software itself, data, and people. Then we're going to see the types of GIS data. There are two types of GIS data, vector data and raster data. We're going to talk about it and we're going to present it. Then under module 3, we are going to see data source and management. Yes, no, module 3, which was data source and management. Under there, we are going to discuss on health-related data sources, e.g. surveys, administrative data. We are going to talk about geographic data collection methods. We are going to talk about data quality, accuracy, and reliability. Then we are going to talk about data integration techniques. From there, we are going to move to module 4. On module 4, we are going to see GIS remote sensing mapping techniques. Under that module, we are going to see creating and interpreting maps. We are going to see the different spatial analysis methods. We are going to discuss on thematic mapping for health indicators. Then we are going to discuss lastly on visualization techniques for public health data. Then we move to Model 5. Model 5, which was disease surveillance and outbreak investigation. Here we are going to see GIS machine application in disease mapping. We are going to also see monitoring and tracking infectious diseases. We are going to see an example case studies of outbreak investigation using our GIS and remote sensing technique. Then model 6, which is health resource allocation and planning. Under this model, we are going to deal with analyzing health service distribution. We are going to deal with identifying underserved population. Here, well, we are going to make good use of our Google Earth Pro and we are going to integrate it with our installer ArcGIS. Then lastly, under Model 6, we are going to deal with GIS in health facility planning and optimization. Then we move to Model 7. Model 7, we are going to discuss on environmental health and GIS. Under that model, we are going to see assessing environmental impact on health. We are going to see mapping environmental hazard. Lastly, on that model, we are going to deal with case study linking environmental factors to health outcomes. We are going to move to model 8. Model 8 is which was an epidemiological application of GIS and remote sensing. Under this method, we are going to see spatial epidemiology techniques. Then we are going to we are going to also deal with examining the relationship between geography and health outcomes. We are going to deal lastly with utilizing GIS for community health assessment. Then we go to model 9, emergency preparedness and response. Under this model, we are going to work on the role of GIS in public health emergency. Then we're going to see how we can work with real-time mapping and tracking during crisis. Then we are going to see lastly case studies on disaster response using GIS and remote sensing, of course. Model 10 we are going to deal with here. Model 10 is model 10, which is the ethical considerations and challenges. Under this model, we are going to see privacy and confidentiality issues in GIS and remote sensing. We are going to see ethical use of spatial data in public health. We are going to also deal lastly with addressing data disparities and equity concerns. Then we move to model 11. Model 11 here, a lot of practical work, hand-on GIS training. Under this model, we are going to deal with introduction to GIS software, ArcGIS, QGIS. ArcGIS is a licensed software, and we are going to see the open source software like QGIS. We are going to discuss on them. Then we are going to see practical exercises in data mapping and analysis. Then we are also going to see creating a public health project using GIS tools. Yeah, so a lot of practical in this section. Model 12, we are going to discuss on the future direction and innovations in GIS. Under this model, we are going to see emerging technology, e.g. remote sensing, mobile GIS, the role of GIS in addressing global health challenges, then we are going to see the opportunities for further research and application in public health.